Hey guys, it's Dr. Emer. We're in New York and we have one of my favorite patients. She's beautiful and she said she had to go on Instagram to show all the women of her age that we do things for preventative lifting, for improvement in herself. She doesn't need this. She looks great, but this is what she does for little tweaks to keep herself looking great at her age and feeling good about herself. Her personality is much stronger than anything I can do with these fillers. But given that, if you take a look, nice jawline, really nice even complexion. You know, we start to get a little bit of fine lines, a little bit of sagging. Some women get a little hollowing under the eyes. Actually, she has less than some of my younger patients that come into me with really deep hollows. So she's doing very well. We're going to do a combination of fillers and Sculptra, building collagen and also do immediate lifting. What I want to do for her, because she has a nice structured face, if you look at the angle here from her chin to her cheekbone, it's a perfect angle actually. So all we want to do is kind of define that. So we're going to use, our first step is going to be to use a little bit of Voluma to give her some lift. And the reason I like this for her is we see her maybe every quarter, let's say. She's not going to need a lot of this. It's just going to be a small amount.
See you tomorrow, Karina.
But it's going to, oh, someone already said we'll see you tomorrow?
Mm-hmm.
That's cute. But you can see, like, even just in a few pokes, and in some places I'll use a cannula and some I'm going to use a needle. With her, I'm just going to go really slow using the needle. And the reason I'm doing that is I want very specific lift. With a cannula, it's going to be really challenging to get that type of lift. So I'm just doing that right at the edge of the bone, only about a quarter to half a syringe, not too much, because we're also going to use some filler for the eye. That's perfect. So that's going to give us some definition along here. And then what I would do typically is then go a little bit more midline to the malar bag and sort of the under eye area and just do a little blending. We're going to do that throughout. We're going to come a little bit higher towards the eye area, just a small bit. You're doing great. And then one more posteriorly. And then I'm going to go to the other side. And typically what I do here is we're going to just hold that lightly in a sec. And then what I'm going to do with that little bit I have, that angle, I want it to match the angle I'm going to do on her chin. So we're just going to do a small amount, nothing crazy. Just a little. And I always tell people, you know, when you see this at first, a little swollen, the needle pokes, etc., then when it settles in, it looks great. And then it holds for you. Hold right here with your right hand, just light. Get rid of that. Now I'm going to come to the other side. We're going to do a similar blend. Now I'm going to do some blending. You doing okay?
Mm-hmm.
Good.
Doing fine.
So again, we see her mid-face, nice volume. We're going to follow the angle here right along her cheekbone. Just a small bit. We call this just female contouring, softening. You know, nowadays some people are really overdoing it with the amount that they're injecting. In my opinion, it's better to do very small amounts over time. I'd rather somebody come in every 2-3 months and do, you know, a couple syringes over the course of a year to get that full contour, and then it looks more natural. We're also going to be using a little Sculptra on her, which I like because that builds over time. Sculptra is made of a material that just builds collagen. So you can see we elevated that cheekbone lightly. Now we're going to just soften the OG curve is what it's called between the trough and the mid-face. Just a small amount, kind of blending. Perfect. And then a little bit to the apple of the cheek. Great. Great. And then I'm going to come back now to the chin and do the opposite side. Again, saved a little bit from that syringe. One more. And for her, you don't want to widen her chin. You just want to project it. Now hold here lightly.
Tell him to come in.
Perfect. So I'm going slow because that helps us limit any bruising, any major bruising or swelling. So now I'm just going to go while we're relaxing the cheek area, because I'm going to do the under eye in a second. More gauze.
Don't you do it.
We're going to go to the folds. take that back. Look all the way up, look good. Smile. Smile. Okay, relax. So we're gonna follow her natural folds. What are you doing?
That's fine. That's fine.
Who knows what's going on over there?
Wait after.
Everything was great.
Okay.
You guys okay?
Someone's ready to come in.
Oh, really?
They're like, I want this.
See? This is what can happen. So now we're gonna do just softening our folds. I'm gonna use a cannula here because there's a few reasons. One is, in this one we're gonna use refine. I don't want a lot of volume per se here. I just want softening of the fold, and this filler is very soft, and it also moves very well with the tissue. So by using that here, and then also we're going to do a little bit around the chin, we're going to be able to really soften the area and just improve our overall fold as well. Does the cannula hurt or are you okay?
I don't even feel it.
Good. Yeah, the cannula is nice because and I'm going to use Volbella here because we used Voluma deeper. This is going to help us. We're going to use this to her under eyes and her lip. This again is a filler that's soft but lasts a little bit longer. So right up here you can see where my cannula is, right in the trough, but less likely to bruise because we're using a cannula. Give a little bit of volume and support to both the under eye and the medial and the cheek fat pads. And go to all areas of the under eye. And you can see already immediate improvement. We'll just do a little bit more. I like to be a little conservative with the under eye. I don't want it to swell too much with filler, so but and get a nice improvement here. And then also you can see that little area right here by the edge of the eye that we want to give some volume to.
How do I look?
Looks amazing. Look at the one eye, close this eye, or let them see, just look straight ahead. You can see even with the one eye versus the other, and there's literally no eye bag on this side now. It's great. I want you to hold right there now. I'm going to go to the opposite side. It looks really good. You know, this is all independent. We're doing contouring of all areas. This is why it's taking a while. But that's okay. That's what we want to do. Then it balances. Otherwise, people look unbalanced when they do it the opposite way and they don't do it correct. So we're going right up in here. You can see where the cannula is, right there. And fill that area.